Say women live longer. Our health spans are shorter. 56% of Australian women over the age of 15 already have at least one chronic health condition. And I like to say it's not a women's health problem. It's actually a global economic crisis.
Oh, nice.
Why are we not solving or considering women's health in that way? And our mission is to transform every woman's experience of healthcare and to close the gender health gap. And I remember investors along the way saying, you can't be a CEO and do a PhD. We've been silenced for a really long time. And I don't think it's just in healthcare. The more that you do learn to speak up, the more you'll trust yourself and feel confident. But I knew that we had to do things differently for women's health.
This is Fernwood Unfiltered, the podcast for straight up expert-backed advice when it comes to women's mental health and fitness. If you've ever walked out of a doctor's appointment feeling unheard, feeling confused, or second-guessing your own symptoms, and you're craving real practical guidance on how to speak up and get the care you deserve, this episode is for you. Today, we meet Dr. Ariella Heffernan-Marks. As one of the few global experts in both AI and women's health, Dr. Ariella's app Ovum is on track to become the world's leading FemTech company, built to close the gender health gap and redefine what intelligent, personalised care really, really means. Dr. Ariella, welcome to Fernwood Unfiltered.
Thank you. And thank you for such a lovely introduction.
What do you hope our listeners today get out of our conversation?
Hopefully some practical tips on how to advocate, some tools that you can use to support yourself in those like clinical decision-making processes, and to trust your intuition, to trust yourself, believe yourself. I think that that's the key takeaway from it all.
I want to get into advocacy and just exactly what that means, how we can empower ourselves, how we put that into practice. But first off, intuition. What is it and how does it work?
Oh, wow. Big question. I think intuition feels different for different people. I think that's the number one thing is it's a subjective experience. It's a gut feel. So to be able to describe it in finite words is almost impossible because it's a feeling. And I think it's something that you learn to tap into. And some people, as we know, are very intuitive and some maybe not, but it's there. And I think it's about finding it and knowing that it can be quiet sometimes. But the more that you almost like, we're talking about fitness, work a muscle, the stronger it gets. And so I'm probably someone who's been somewhere in the middle, but through my journey and intuitive experiences that I've had, it's gotten stronger and stronger because I've listened to it and now I can recognize it. And it's like that recognition piece that I think is like really important.
Why do you think that we ignore it?
For those that do ignore it, because I think there's some people that I'm sure you've met that, you know, everything's an intuitive decision. I think if we're referring obviously to the context of this podcast and clinical experiences where I think intuition, especially women, are biologically intuitive with their bodies. I think we've been silenced for a really long time and told to ignore our gut feel, to actually physically be quiet. And I don't think it's just in healthcare. I think it's in numerous industries, but that feeds into the clinical experience as well. And I think when you're told to ignore that feeling, as I've just spoken to, it gets quieter and quieter and quieter. And then you kind of lose touch with it, even though it's sitting somewhere there. So I think, you know, that's why I say to women, you know, if it is there, listen to it and don't feel scared to even just raise the question, because if you don't ask, you'll never know. And in clinical experiences, I think the more that you do learn to speak up and act on that, the more you'll trust yourself and feel confident and get the outcome that you deserve.
As someone who is a doctor, works in the field, how have you found that your own intuition or that own gut feeling, how have you let yourself make that grow louder throughout the course of both your career but also personally with challenges that you faced?
A big influence I'd like to actually say is my mum. When I talk about the spectrum of intuitive people, she's like, I woke up and I had a dream and I know. And then she's like, right. So I'm talking like that's what I've had around me. So I already had that as a child.
I love that.
Love that. But it took my own experiences to really enhance my own intuition. So it was a blend of listening to her and then my own personal experiences and professional. So if we talk about my journey with Ovum, and obviously we haven't touched on like what Ovum is yet, but I was a third-year medical student. I never wanted to be an entrepreneur. I never even thought about it. And I had my own personal health experiences with chronic migraine, which allowed me to see the disparities in women's healthcare. But, just fast forwarding to like when I actually had the light bulb moment, I was like driving in my car and I thought, wow, if we have a book that tracks children's development, why don't we do something like that for women that can empower them with their health data and empower them through health literacy so they can advocate for themselves? And then we feed that back into data and research. We know there's no data on women. But that was a moment of a gut feel. It was so strong. I had this like vision. I'm not sure if you've watched So Raven. You know when she has that like eye?
Yes,
that's how I feel.
do.
That's how I felt.
And I wasn't expecting a So Ray
I you know what
reference on this podcast, but I'm all for it.
I know. Yes. So Raven for any 90s kids who watch Disney Channel. And that's what it felt like. I was like, is this what I'm going to do with the rest of my life? I was like, there's something in me. I was like, yes, it is. But I'd never done anything in the world of like commercialization or in health tech. So it was that moment and I listened to it. And I continuously had to listen to it because I didn't have validation in the early days of this being, something that was going to lead to where I am today 4 years later. And then it was other things along the way. So, I'm now doing my PhD at the same time as obviously running a company, and I've left medicine. And I remember investors along the way saying, you can't be a CEO and do a PhD. But something in me said, this is what I need to do for my company. And actually that PhD has now actually allowed for my, biggest investment. That was one of the decisions the investors at the end of the day said, because you're now a domain expert in that thing, we now want to back you even more. So there was that. There was other people who said, why are you running a FemTech company that's so broad? Why are you taking a lifespan approach to women's healthcare rather than, a more, siloed niche approach, and then you come out and you take over the world? And I said, well, because it's the wrong approach to women's health. And that was purely a gut feel, plus obviously things that I'd learned along the way from reproductive biology before medicine. But I knew that we had to do things differently for women's health, but we weren't talking about it yet. Gender Health Gap report wasn't out either.
Right. Okay. So I want to get to Ovum and exactly what it is and how it works. But what are some of those misconceptions or those frustrations that you found when you were studying when it came to people talking about women's health that made you think that there was a need for Ovum to exist?
I think when this all started, we weren't necessarily talking about it. That's the thing. I think along the journey in the last 4 years, as you would know, the conversation has become greater and more surveys have come out. We've seen more inquiries, for example, the inquiry into women's pain. But it all started from dealing with my own chronic health issues, and even being quite a health literate woman, I would say in top 1% as a doctor, I was still told your pain's just anxiety, it's all psychosomatic, it's because you started medicine, it's because you've moved states. And I said, well, waking up in pain, feeling dizzy and not being able to see properly every day is like I think that's beyond anxiety, and it took 3 years to get medicated. And from that own personal experience, I think it made me even more empathetic to the patient experience, to the woman's experience. And then I was a doctor and a patient at the same time, having this really, one doctor actually said to me, as a clinician, you're super privileged because life is a performance and you have front row seats. And such a powerful statement. And so I felt like I had this experience whilst also dealing with the inequities of being a woman in healthcare. And so then it was COVID, and I began to really look at, what is leading to this empowerment for women? Why are women experiencing these inequities? And I saw that it was because they were fearful of the healthcare system. They've been dismissed or gaslit for so long, so their voices were being silenced. They were going to social media rather than healthcare providers, leading to lower health literacy and a rise in chronic health conditions. So 56% of Australian women over the age of 15 already have at least one chronic health condition, which is shocking. God. By 65, that's 87%.
Jeez, really?
Yeah. I know the stats when you delve into them are just mind blowing. So there was that I began to see. Second of all, I just touched on before, I did reproductive biology before medicine, so I really understood the cycle and interconnected nature of women's bodies. And then I looked at our system and I said, well, so siloed and fragmented, why are we not integrating this data? And
when you say siloed, what do you mean?
So we have the primary care doctor, we may have a midwife or an obstetrician gynecologist, the fertility doctor, the physio, the dietitian, and everyone plays a really important role in that journey for every patient, but for women. Yet the data at each of these appointments is kept in different places.
Yes.
And now we're seeing, even my experience as a woman I saw numerous GPs. It was whoever I could get into, really. And you think about being even a young girl and how many doctors you might go to when you're trialing different contraceptions and things like that. depending on what you need. So I think you just think about all that data and you think about women's physiology and you go, wait, hang on a second. If we put that all together, surely we'd be able to understand our bodies better. And then you look at diagnostic timelines for women, and I think, endometriosis we know is 7 to 12 years. I wonder if we actually collected data on, let's just say 1,000 women starting from the age of 12 to 13 when they're, starting to get their first period to 25, 30, what would we even be able to understand from that? With Ovum, we're actually collecting data from 15 through to we have women 80 years old on the app. So you can imagine the aim is that we actually begin to fill that gap. And then thirdly, I began to learn about this research gap, so the fact that women have not been equally represented in clinical trials, and I was pretty shocked. And I remember trying to find some more information. At the time, it just shows how much we weren't talking about it. There was nothing on gender health gap. A lifespan approach to women's healthcare, I think I could find like one paper on. It was really hard. And so we weren't talking about it. And that was where the intuition feeds back in, because I had to go, no, this is something and this is what we need to do. And even if I can't find all the evidence on it, I know this needs to exist. And then I started speaking to women, spoken to over 500 women across like 15 through to 75 about what the barriers in healthcare are, where they're accessing health information, attitudes towards digital technologies. Now we're doing a formal clinical trial on this. But as I spoke to women, it just validated more and more and more. And then actually a year after we started working on the prototype, the Gender Health Gap report came out, which was done by McKinsey in 2023. And it says, women are spending 25% more time in poor health compared to men, mainly during their working years, so 18 to 64.
Sorry, say that stat again. I just went, what?
Yeah.
Yeah.
Women are spending 25% more time in poor health compared to men during their working years, so 18 to 64.
Okay.
So our lifespan, we always say women live longer, but our health spans are shorter, which is the amount of years we live in good health. 25%, that's a big number.
Huge number.
It's huge.
Huge number.
And that number, if we look at what's contributing to that, 47% of the conditions that women are suffering from are not reproductive, yet all of the solutions, everything we talk about is reproductive. Yeah. Only 5% is due to reproductive or maternal conditions. Not to undermine the importance and the influence of those conditions, but if we look at the percentages, why are we not solving or considering women's health in that way, and why are we not discussing it? And I'm grateful that, the federal government and the state government are starting to do more inquiries, understand inequities in women's healthcare. But I think we could definitely be doing more, especially when allocating budget and things, to looking at the other conditions like autoimmune conditions, musculoskeletal, mental health, things that women are disproportionately suffering from that are not that. And that gender health gap, just to bring it to an economic cost, is costing our global economy $1 trillion annually.
$1 trillion?
Annually.
Whoa. So I actually know, this is very random, but I know a little bit of fun facts about how big $1 trillion is, because people can say these numbers, right?
Yes, that's
and it's
great.
Like $1 trillion, oh, yeah. What does that mean? What does that mean? Well, one of my favorite things is that it would take, I think, 11 or 12 days. If we were going to count to 1 million, it would take 32 years to count to 1 billion. So saying all of the numbers out loud, 1, 2, 3. For $1 trillion, that's like in the tens of thousands of years.
Wow.
If we were going to count one by one to actually get to that point. There's about 3 trillion trees on the planet. So that's like a third.
It's a great way of actually making you realize how big that number is. Because I think we do, especially when we're talking about, recent salary changes for certain people.
But just as in summary, trillion, a lot.
Big. It's a massive amount.
Yes.
And it's also just to remember that that's every 12 months. And I think when you break it,
it's every 12 months. I'd already forgotten. I was like,
yeah,
what?
It's not just $1 trillion. Like I say it's a $1 trillion gap. It's actually a bigger gap than that. And I guess you think about it, if women are over 50% of the population, and during 18 to 64, which is like our prime years of, working and contributing to the economy, we can't for whatever reason. And usually it's a health issue, but then it could also be the fact that we're not being promoted to certain positions because our chronic health is impacting how many days we can spend at work or actually reach those positions, or it's reproductive as well. Obviously, we may take time off work for children.
Well, Dr. Ariella, are you saying that it would benefit the entire world if women's health was addressed so that we could stay in the workforce?
Well, I do think that there's an element of yes. Like I think
give
us the opportunity. I'm not saying that. Be careful about that, because I do think that women who may not be what they want, and that's okay.
Yeah.
What I'm saying is give us the opportunity, the fair chance to contribute as much as we would like as an individual. And I like to say it's not a women's health problem. It's actually a global economic crisis.
Oh, nice. Yes. Yes.
If 50% of the population, doesn't matter if you're a man or a woman, cannot work to their fullest potential because the inequities in their experience of health, let's take gender out of it for a second, is it a women's health issue or is it just a global economic crisis?
Yeah.
And I think that's what we need to be reframing as well.
We are all about reframing on this podcast. In terms of Ovum itself, what's your elevator pitch? What is Ovum, your app?
So Ovum is the first AA health partner for women. So it allows women to integrate all of their health data across their lifespan so they can be empowered through health literacy, advocate for themselves in clinical appointments, which leads to shared decision-making, better engagement in preventative health behaviours and improved health outcomes for women. But at the same time, at a population level, we're collecting the largest women's health proprietary data set to feed back into addressing the biases we know exist both within research and artificial intelligence. And our mission is to transform every woman's experience of healthcare and to close the gender health gap.
That's a big job.
It's a big job.
A really big job.
Yeah, it's quite big, you know. And that's where I think there's a little element of delusion that has to just feed into the journey. The intuition of knowing is like, go back to the So Raven. You kind of have to see this like ginormous thing existing and know that you're going to get there and know that you're the right person too, that you've been chosen to do that. And you have to tap into that because it's not an easy journey. It's not an easy goal.
No.
So.
No. Excuse my ignorance here, but when women are using the platform itself, is it something that you sign into and then you're uploading all of that data into your interface?
So it's an app on your phone. I like to say it's like a personal health ally in your pocket whenever you need.
Oh, nice. I could use one of them.
Yeah, exactly. I think we all could. And, I want to say it's not just for chronic health. It could be just wellness, mindfulness. It covers it all. We like to say instead of having 7 apps, so you have an app for nutrition, workouts, mental health, pregnancy, cycles. It's all in one place. So it integrates medical reports, wearable data, and then everything's through chat. So symptom tracking, medications, appointments, fitness, diet, nutrition, and all reproductive health. So that's cycle tracking, pregnancy, fertility, perimenopause, and menopause, all in one place. And so there's an element of, yes, you're putting in some data, but then there's also the passive, obviously, integration with wearables as well.
Wow. Okay.
Yes. So
it just gets greater and greater, your mission. How does women being dismissed in modern, everyday medical settings, how does that affect our society?
I think it's a very big question, and there's probably a lot of nuances and interplay of numerous factors in that. But I think that the dismissal comes down to actually a sense of confidence, of sense of self and esteem. And I think that when you go to a doctor, you're quite vulnerable. When you're there, you're weak, you're sick, you're dealing with obviously maybe something massive in your life that's happened, you're going for that support. And when you're in that vulnerable place and a person of authority or power shuts you down, dismisses you in some way, there's an element that I believe like breaks that sense of self and confidence down. And whether that's only in that clinical setting or whether that then actually interplays in other settings where there may be an authority where it's actually teaching them not to speak up. And we obviously spoke to this before. So I think there's that element of it, which is like really I think sad, destructive. But then I think there's the more obviously kind of physical side, whereas, as I said, 50% of the population, over 50% is women. And so if they're not getting the health care that they need, if they're not able to actually deal with acute symptoms so they then become a chronic symptom, that then impacts our economy in so many different ways, whether that's costs, whether that's resources, because the more people that are dealing with chronic health issues, the more resources, and we know that our healthcare system is already burnt out and overrun. So I think that there's kind of a very psychosocial impact from the dismissal of clinicians. I also want to note, though, that I don't always think dismissal from clinicians is intentional. Mm-hmm. I think that as I just said, there's a big system impact. We have clinicians that have 7 minutes to 10 minutes to spend with their patient. They've got KPIs. I'm talking, obviously, there's primary care versus specialists. There's all these nuances to it. they're burnt out. There's only so much emotional capacity. And I think that's why we need to be integrating technology in a safe way, like artificial intelligence, because we know from reports, like another report from McKinsey on generative AI, looked at the impacts of productivity. And it's great. Taking away the administrative burden of people, especially in professions like medicine, allows for more emotional capacity. That emotional capacity is there for clinicians. I think we would see a decline in this sense of feeling dismissed for women, and men have their own biases in the healthcare system they experience as well.
I do think that there's always this conversation about, AI is in such a negative way, but whenever I've heard it used positively at different conferences, whatever it may be, it has often been in the health field or the medical field, because for those very reasons that you talk about. Talk about this journey between having an acute problem then become or develop into a chronic problem. What is that journey? How does that happen?
So in acute, we have time limits on it in medicine, but like to put it simply is acute is more something that happens in the short term. So you have a short-term symptom that maybe comes and goes. You have like a one-off treatment almost. It may not just be a week. We do have, you like to say it's usually a few months. As soon as it kind of goes on for over a few months, lingering, numerous treatments, things just not progressing, or it's actually escalating, then it's becoming a chronic problem. Sometimes those symptoms may be classified as a specific condition. So I think obviously, I've mentioned like chronic migraine. So you could have a, once-off headache, a once-off type of headache that presents in a migraine type fashion. But if you're getting those regularly enough, it doesn't have to be every single day, over a period of like, let's just say over 6 months or more, that's when we start to say, okay, this is chronic migraine. If that just to put contextually. And I think, when you start going into that chronic world, and actually I had this really interesting discussion with a medical anthropologist.
Medical anthropologist?
Yes, I know.
It's a fancy title.
I know, and there's only a few of them.
Wow.
It was actually, we did a podcast at South by Southwest.
Yes.
And we just talked about the system is actually not designed for like the chronic patient, because sometimes with chronic symptoms, it's not necessarily about complete resolving of that condition or symptom. It's actually about management and dealing with the emotions and the mental health side of things as well, because there's hopelessness, there's fatigue, there's lack of confidence. There can be a whole chronic disease identity that actually happens, a whole path that can happen with it. And I even went on it myself. But our system is very much like recognize presentation, investigate, diagnose, treat. But what about that person that maybe that treatment doesn't lead to a conclusion, that presentation is still there? And it was a really interesting discussion, and I think it's something that we all need to be aware of, especially those who are listening who may be going through chronic symptoms. They're probably saying, yes, I know, I've gone to so many different doctors, I've had so many different opinions, I'm so exhausted, I'm struggling to manage, and every time I'm expected for things to just get better, and it doesn't, and that's exhausting. That is really exhausting, and it's talk about like true acceptance. And I had to learn this because I was fighting my own symptoms, finding when am I going to be better? When am I going to be better? When am I going to be normal? And it's this concept of like normal. It's like, what is normal? What if like this existence of chronic is your new normal, but if you're still trying to fight what you were before, that's a whole nother emotional toll, which can actually make your symptoms worse. So, sorry, I've kind of digressed on that, but I'm sure it relates to people who are going through chronic health issues who are listening. And I think the most important thing in that journey is that acceptance. But you also need a system that allows you to accept. Because the system and the clinicians that you're going to for advice are not allowing you to accept, or not pushing you, or they're pushing you off really accepting that that's maybe your new normal. That can be, your expectation is just mismatched. When I found true acceptance with my symptoms, I actually started to see them get better, which is really interesting.
So with that acceptance, the only way to do that, I guess, is to have all of the knowledge.
Yes.
And to be able to then empower yourselves to get to that stage. But if you don't have all of the knowledge, all of the tracking, all of the data, that makes that really difficult. So to bring it back to Ovum for just a second, why do you think it is so important for women in particular to be far more health literate than we currently are, or at least use these kind of practical services to better empower ourselves?
Well, I think we all know the line, knowledge is power, right? So I think it leads to that as a base, is we know that health literacy is the foundation of health empowerment. And I think women, we are very complex and we are quite individual in our complexities as well. So, not every cycle is the same, not every pregnancy is the same. That then impacts how we present with chronic conditions differently. So I think if we can have all of the information, we can understand ourselves better, which then gives us the power and the confidence to then be in that clinical appointment where there may be a power imbalance and to advocate and say, actually, no, like I have the information, I've tracked it and I can see that this is a thing, and I've let's just bring it back to Ovum. Let's just say I've talked about it and I've actually prepared for this appointment, which Ovum helps you do. And I've actually created a report, which Ovum also helps you do, to share with your clinician. And it's been created by clinicians as well. So it's very short, very condensed, and it's specialized for your type of clinician. Let's just say it's a gastroenterologist or it's a psychiatrist. It will be prepared in that specific way. So having that as a tool to say, like, no, I've done the work, I understand my body, I've done the research, and now I'm here to I'm having a conversation with you. It's a collaborative conversation. And to another guest who actually said to me, what did she say? And as a clinician, this was really interesting for me to hear. She said, the patient, or you as the woman, you're the decision maker. You forget that. They're your advisor. The clinician is your advisor. And for some reason, somewhere along the way, we've forgotten that. And on top of that is the gender biases that exist. And I think women, I've spoken to a lot of women, I just freeze. Actually can't even ask a question. And I walk and I go, what? I didn't even ask for what I came here for. I don't even know what they said. Like, it's the anxiety from the power imbalance is huge. But I think if you go in a bit more equipped, even if you still have that anxiety, you've got this like strong foundation on which to stand in a sometimes frightening and scary situation when you're already feeling vulnerable. So I would say that. And then I think in the kind of greater population level is, as women, if we can come together, power in numbers, and collect mass data sets from women as young as, let's just say it's 12 all the way through to 80 plus, with not just reproductive data, which is everything that seems to be collected on women and everything else doesn't matter, with our medical report data, with our biometric data, and bring that together and actually feed that back into research that translates into better understanding of women's bodies and treatments. I think that is huge. And that's obviously what we're trying to do at Ovum as well. So we've already found, like, we've had over 47,000 chats in like 4 months. Obviously it's all anonymous and aggregated. So we don't know who anyone is. We've had like over 20,000 health insights. So when you speak to Ovum, we record 6 different health factors in different colours. So it's all very pretty as well. I just want to say Ovum is very beautiful.
And look, it doesn't necessarily have to matter, but it matters to me. I'm using myself as a sample size.
Yeah.
Like, if something was aesthetically pleasing and I liked the way it looked when I was using it, I would use it more.
Exactly. And I think as women, like, beauty, fashion, like those industries are the most influential industries. So why does healthcare have to be so the opposite? And that's been my whole approach with Ovum, is we actually run it like a fashion brand. We do quarterly campaigns. We've just released a massive tabloid called Her Issue, which is going into fashion stores with gift cards. And it's like, why can't we bring that together? And so Ovum is intentionally beautiful and aspirational and engaging and not cluttered and juvenile. I don't know why women's health has to be put down to cartoons all the time.
I know, it's always a cartoon. There's always a
cartoon.
Butterfly.
And
there's always a butterfly.
Always. And I just...
Nothing wrong with butterflies, but why are you there?
No. And it's also like, I mean, my experience with other health apps for women is like super cluttered, super overwhelming. I just want to like easily integrate already my health, which is already overwhelming enough. So I think that, with Ovum, we've been very intentional about the design. I'm very intentional about the individual purpose, which is helping you integrate your health in a really seamless way, but also at a population level is bringing that back into the world and actually shifting women's health like globally, translating into better medications and treatments for women.
Again, excuse my ignorance here, Dr. Ariella, but when you say collate health data, so I'm there with your platform and I have health data. What do you mean by health data? Like, I'm taking it back to real basics.
Yeah,
What am I putting in there?
Yeah. So we like to say, so any medical report data, that could be a letter from your doctor, it could be a blood test that you've had,
Right.
result or path form, it could be a script, any medical document that you might have in your health journey is like a number one. And then the AI itself is a chat with a longitudinal memory system. So everything that you put in, it will remember. So you can talk about general symptoms. It could be anything. It could be headache. It could be abdominal pain. It could be symptoms related to your cycle. You could put in medications. So you could say, I'm taking these medications at this dose, this frequency. Can you give me a reminder to do that? Appointments. So these are some appointments I have with my dietitian, my physio. Can you help me prepare for these appointments? And it will check in with you a day before and 2 hours after to help you with that preparation and advocacy. You can put in diet tracking. So if you want to track your meals throughout your day, your protein intake, calories, if you want to track your workouts. So you may even have another app where you've got a workout plan. You can even like screenshot that. I do this and I put it into Ovum and it brings it together with the other things that I'm experiencing. So it might be symptoms, calorie intake, for example. So really bring that together. And then all of your reproductive health data. So we have a calendar view like other apps, but you can also do it through chat, which is logging your cycle. You may be pregnant. We also obviously account for pregnancy loss as well. You may be on a fertility journey. You can pop all of that in there. Or you may be transitioning through perimenopause and menopause, and it does cater for those changes in your cycle and symptoms that you may be tracking. So that's just a very summarized idea of all the things that you can put into it.
Okay, so that's the data. So I've put in that kind of data.
Yes.
And then through that data, Ovum, then the AI helps me build different reports that I could then use with my specialists and talk about exactly what's going on with me.
Yes, I mean, you can use it in that way. You could also just use it just for you. So if you just want a safe and non-judgmental space to speak and learn about your health and you're not necessarily seeing specialists, it's there as a companion. So it is trained obviously by women for women. So the way in which it speaks to you is very compassionate and empathetic. We'll be moving towards also being able to select your tone in the future, which is quite exciting. So you'll have a conversation about whatever it is that you want to. It may even be mental health. So if you're feeling stressed or overwhelmed, and it can give you exercises that you can do to calm yourself down or strategies. So just to keep it a bit broader than only health, like you have to have a chronic health symptom because you can use it in so many different ways. It's whatever health journey you're on at every life stage. And then it can create reports for you if you would like to share with. It could be a clinician, it could be a dietitian, it could be a naturopath. Whoever that provider is that you want to share information with, it can do that for you as well. And I forgot to say that it will have wearable integration. So if you're wearing, let's say it's an Oura Ring, an Apple Watch, Fitbit, Whoop, it will integrate that data. So your sleep and your heart rate variability and your calories or your steps, everything will be tracked in Ovum as well.
Just in the one place.
Yeah.
So it's an easy to find one.
Exactly.
For want of a better word, one-stop shop.
Yeah, exactly.
One-stop shop.
Yeah,
Yeah,
exactly.
I got it right.
Like I said, like 7 apps in one.
Yeah.
So all of those, you usually think about how many apps you'd have for all those things. The idea is have one central place with a really good memory system. So its memory system already like outperforms the likes of ChatGPT that actually remembers you. And also we have a clinical database, like our knowledge library behind the AI. It's called a retrieval augmented generation system. It has been created by dual-trained endocrinologists and chronic gen med physicians and women's health specialists. And then we have some medical students as well because we like to teach medical students about digital tech and getting involved in AI. And so we've created that with the most up-to-date clinical guidelines in Australia that's feeding into the AI and the advice that it's giving you as well.
And then your data is used anonymously then?
If you would like. You can opt in and opt out.
You can opt in or opt out. Right, okay.
Yes.
Okay, but then you are essentially trying to fill the gargantuan hole or gap that you identified all of those years ago.
Exactly.
And doing the research that previous generations haven't done or haven't been able to do.
Exactly.
Does that annoy you that it's fallen to you? That's
a funny question. You're just like really annoyed and exhausted.
Yeah, just like because there would be part of that though, right? Where, like, oh, yep, here's this $1 trillion hole annually that exists in the gap between women's health. And, oh, yep, no, I can work to fill that. Oh, yep, no worries. Oh, I'll just go back to previous generations, see what they've done. Nothing. Cool. Okay, let's go.
And that's a really funny, I think.
I'm simplifying it.
I think, I like to say that like ignorance is bliss almost.
Yeah.
Like there was just no understanding. I mean, this report came out in 2023. So when I started working on this is what I was, as I said, it was what I was seeing in my gut feel. No one even knew there was a gap. And then I was seeing it. And then they just validated actually that report. I remember reading the end of it. It was like, the solution to this gap is AI, unbiased data sets, and interoperable electronic medical records. I was like, that sounds like my app. Interesting that I've already come up with that.
You're like, huzzah, the wheels are in motion.
Exactly. I think, probably what more frustrates me is that like we have created a solution and it's here and it's, I just like to get this out faster to the world.
Yeah.
But, I'm trying to do it safely. So we're doing clinical trials, getting it clinically validated. We're nationally and globally compliant with privacy principles. We even Face ID in the app. Like it's serious. But in different markets, there's different regulations. And so it's just a bit of a slower process. But I'd say the only bit of frustration is that I feel that, even seeing the women using it. So we've done like our impact report. So we've looked at like how we're closing the gap. So looking at interpersonal, systemic and research barriers. They're the three barriers that contribute to the gap. And we can see that women using Ovum are already 4 times more likely to take action in their health, 2 times more likely to feel heard by a clinician. So it's like I can see the impact and I can hear from women telling me stories about how they've got an earlier diagnosis, not that Ovum's diagnostic, but it's helped them advocate or it's helped them get a better outcome in a treatment plan because they've questioned things. And that for me is like, wow, if we're already having this impact in 4 months in market with like we call it like a minimal viable product and very early product, which is still very good product. I just want to go faster and get it to more women. And I think that's probably the most frustrating thing. But I'm happy to be the one solving it because I think I've got a very unique skill set in being able to do so. And I'm very passionate and I wouldn't change it for the world.
It is so important that women start tracking this kind of stuff. We need to know what's going on with us.
It is very important. And I think it's shifting away from, I know we're all very good at cycle tracking, but we need to be tracking our bodies more holistically because having that information, as I said, knowledge is power and that knowledge helps you advocate for yourself beyond only women as being reproductive. It's how can you live a better life? How can we increase women's health span? How can we, get to 80 plus and be healthier? And yes, reproductive health is a big part and influence. Our hormones of our lifespan are, but there's all the other things that make up our experiences. And I guess it's preventative health, right? But preventative health is not only cycle tracking for women, it's so much broader. And I think that we forget that we need to be doing both and together. They're not separate. So having the separate tracker that tracks your sleep and your diet and your workout, your cycle tracker and your pregnancy tracker all separate and not integrating that is actually a limit to us as women. And I hope that Ovum can do that, or if it's not Ovum, that this is still a message to women that using any type of journal or tracker to bring that together, that's where the power comes from when being able to advocate for yourself in clinical appointments.
It's making so much sense to me, Dr. Ariella. And if it's making sense to me, I have absolutely no doubt that it's making sense to the woman listening, the person listening. And hey, maybe it needs to be heard by people in your life. If you're getting a lot out of this episode, make sure you do share it with those that you love because there's so much more to learn. We'll be right back.
Have you ever felt like you are guessing your way through your health? That's exactly why we've partnered with Ovum AI. It's an intelligent health tracker designed to help you understand your body on a deeper level, from your cycle and symptoms to your overall well-being, so you can make more informed decisions and advocate for yourself with confidence. As a Fernwood member, you'll get exclusive discounted access to Ovum AI through member perks. Because at Fernwood, as leaders in women's health, we are here to support and empower you beyond the gym.
What other areas of women's health do you think aren't really being talked about so much? And we'll put our reproductive health to the side. That does get a lot of coverage. There's a lot of spotlights on that, as there should be. But what are the other areas?
When we look at obviously the gender health gap and the conditions that women are disproportionately suffering from and contributing to that, so autoimmune conditions, so commonly like thyroid, I think we talk about a little bit, and I'm sure you know a woman in your life that's had a thyroid condition. Musculoskeletal, so for example like back pain, respiratory issues, so we know that like asthma also like presents differently in women, just giving some kind of classic examples. neurological, so migraine. I think, who doesn't know a woman who's got migraine or headache in their life again?
Yeah, can I just jump in there? Because as someone who has experienced a migraine before, you are a chronic sufferer. For people who don't know what it's like, how do you describe it?
It's hard because migraine means cortical disturbance. So that means, the outside of your brain is like the cortex. So it just means there's like a disturbance. So migraine is really different for different people and different factors. So some people have hormonal related, some might be triggered by certain foods. It's very different. But I would say if you're trying to understand headache versus migraine, like migraine in its like most typical sense is you might have like sudden sensitivity to light, changes in your vision. So we call them like scintillations or oscillations, like almost like little floatery things that come into your vision, or you suddenly can't see words on a screen or in front of you and it feels like there's like a piece missing. And that's usually how it starts, and then it might be like a really throbbing pain that you need to sit in a dark room. You might have nausea. You may have dizziness. It just depends on the type of migraine. For some, it might actually come at a very regular interval. So it's coming every 4 weeks at this specific time. It may be related to weather. There's so many different
weather.
Some people will find like certain atmospheric changes can like cause it. It's there's very different types. So I think it's really hard to say, but it's different to that kind of tension headache. I'll take a Panadol. So that's my kind of best way of describing it without saying it's presented in one specific way, because everyone's different. So what was your experience of migraine?
I used to feel really nauseous. I would just have this splitting pain, but it was more like this ache, just this unrelenting ache, but on my left side. So like behind my left eyebrow is where I would feel it.
Yeah.
It was never really on my right, and that's often how I could differentiate, because if I just had a headache, it would be like, a bit of an ache all over my forehead, but it would be on the right-hand side. Whereas for migraine, as soon as I knew that it was like a concentrated ache just on my left side, I was like, oh no, here we go. And I would just, I'd feel super nauseous. I had some light sensitivity, but I know people can get aura. And I didn't. I was fortunate enough not to have that. But it was so debilitating because I just couldn't do anything. And we've already spoken in this episode about how that can affect then your sense of self and identity. And it's really hard because you're like, oh, hang on, you gaslight yourself, I guess. It's like, oh, well, it's a headache. I should be able to function with this.
Yeah, it's exactly, it's exactly that. It's like, and I think that's where it comes back to what I was talking about, is like acceptance. And that's where that identity is shifting, because who am I with this chronic thing? Obviously yours wasn't as chronic, but it was still something that was debilitating, impacted your sense of self and quality of life or ability to function.
How did you get to your acceptance, that true acceptance?
I think I got exhausted from fighting it. I think it was years and years, and mine was very, I had an element of that. I had, so I would have, we call it like kind of like bilateral facial pain, like quite severe around my face, and I would get dizzy and I couldn't see, I'd get aura, and sometimes I would just get a big zigzag across my eye and it would just start, and I'd be like, oh no, it's coming, and I know exactly I'd have to take 2 Panadol, 2 Nurofen, and within 20 minutes it would go. So like mine would kind of vary a little bit, but your trigger symptoms, like you talked about your eye, you just know. It just becomes a thing and you go, yep, I know what's going to happen. But it became, I was having that every single day for a point. So it got to a point where I just fighting and trying to be the person I was before I used to have it every day was almost making the symptoms worse, because it was making me more exhausted. And so as soon as I relinquished that a little bit, plus I eventually started medication, which I still take today, 3 times a day. It's like drinking water. I don't even notice it, and I don't get my migraines. I think that was a big part of it was that the element of anxiety was actually feeding into it more and more and making it worse, and trying to be someone that I probably wasn't anymore. I couldn't go to gym the way I used to. Had to shift from being the weight training 7 times a day to, walking 3 times and doing 2 Pilates. And it sounds like, oh, great, you're still exercising, but it was actually a big shift for me, for someone who like really used exercise as an outlet, and I couldn't use it in the same way because it was more calm exercise. But it was a learning, and I think I'm a better and healthier person because I wasn't pushing myself to, I think, a really unhealthy level of exercising in expectation and stress and perfectionism. So I think there's a big learning, and I think actually I really like to talk about this idea of authentic leadership. So for people that go through chronic symptom, I know we've kind of digressed from migraine, but for any migraine listeners, you've probably gone through this, is you go through this when you start having a chronic condition. It impacts your quality of life and how you function, and then you need to off-ramp. So take a step back, almost compassion, self-care, self-love. And then eventually you have to come back into your life at some point and figure out how you're going to be this person with this chronic thing that you didn't have before. And it's like on-ramping back in. And then it's the new. So who am I in this new world and this new person managing this thing? But through that, you've actually had to like strip back ego, strip back everything, and really come back to who am I? And it's like this authentic leadership comes out of it. And I don't think if I hadn't had this journey with migraine at 25 when I started medicine, I don't think I would have ended up here, because that moment in the car, if we go way back to the beginning of this conversation, came from a place of like pure like empathy and compassion for the women that I was seeing that I don't think I was able to fully have before, because I'd never been a patient like that. So I know we've kind of digressed, but I think it's still an interesting discussion.
No, it so is, because I think it gets to the heart of how you've got here now. Very, very powerfully, but simply too. Because you were impacted or affected by such a debilitating illness, problem, issue. You can then see that so many women, not only in this country, but every woman can go through something like this and need some help and doesn't know necessarily what is happening with her body, with herself.
Yeah, and I think it's also maybe a lesson that you can be really in it and you can feel like you're never going to get out, but there's a growth and there's a learning, and I think that the biggest growth comes from discomfort and going through really hard things. And, I know this is a health podcast and there's probably women listening that are maybe on their health journey or trying to find a way to feel better, to feel healthier, to maybe come out of this place. And I hope it's a lesson to women that it may be challenging right now, but like there is a space to become a more authentic version of yourself, even if it's like really hard right now, and to keep persevering, but also accept where you're at. And you can bring in things to get through it. And I do think it's just finding the right version of healthiness and fitness when in a world where I think there's a lot of talk about like, do this much training, only eat these foods, and that actually pure acceptance of yourself and where you're at, and finding the healthy and balanced version of getting there is the right approach.
Well, I want to get to some practical tips on how we can advocate for ourselves in a moment. But I think to get us there and have some more greater understanding about that and why there's a need for that, are there any common conditions that are just always misdiagnosed or commonly diagnosed?
Yeah. I think we talk, in the media, we talk about heart disease.
Yeah.
And it's not just heart attack, it's other elements of heart disease. Could be hypertension, atrial fibrillations. That's when your heart can go quite fast and irregularly. For actually a lot of women I've spoken to in like focus groups, in surveys, we know that pain generally, but I think abdominal pain, I've had a lot of women who said, oh, actually I went in saying I've got really excruciating pain, turned out to be appendicitis, but they dismissed me and said it was anxiety, or they said it was just like hormonal or, related to my menstrual cycle.
Oh my God.
So I think that, we're talking about migraine and headaches, I think pain, I think fibromyalgia and like chronic fatigue. I think that can also be in men as well, though. Like I think it's a bit of a misunderstood area, but women can disproportionately suffer from that as well.
So knowing that then, and for anyone who might be listening to our conversation and has gone, hang on a second, that does sound like me, or I knew that there is something there, or it just has hurt their gut just feeling a little bit intense right now. It's just clenching, being like, oh, there's something's not quite right. How can we enforce advocacy in our own health journeys? What can that look like?
Yeah, so I think the number one is listening to it. Like if you're going to ignore it, that's not going to get you anywhere. And I think it's, for summers that we spoke about can be quite quiet. And especially if you're the carer of the family and you're really busy, you're juggling family and work and all of the things, it can be very easy to dismiss. So I think it's like listening and actually taking action. Then I think if you're like, okay.
And that taking action, what does that mean?
Number 2.
Oh, number 2. Sorry, I jumped ahead.
No. Somebody were here to question. So taking action, I would say, is actually documenting. We talked about that. So start to document the things that you're feeling are different or changing, whatever that may be, and maybe start to do your own research. I think it comes back to that knowledge is power. So, but finding the right resources. So I'd say, we all have friends and family and things, and that's great. But I would say staying away from like your TikToks and Instagram for that research. Try and go, there's some great government resources. If you're into clinical papers, they can be really confusing. They are there. Or you could, obviously I'm not going to be biased saying you can go to Ovum, but obviously it's a great resource for women to just document and understand maybe what's going on. Obviously there are some AI tools. Like we know that people do go to ChatGPT and Gemini, and I think I don't want to say don't go to them, because I think that there's an element of that just helps you say, okay, what's the bigger problem here? What do I need? Kind of hone down what you need to be asking. I wouldn't say get your conclusions from there. Also, I don't think you should be making clinical decisions, but just getting the information. And then thirdly is actually going to the correct type of practitioner. So I think that there's just a spectrum of types of doctors or providers. It may not just be doctors. Who have certain opinions, and I think it's about finding the right one that always, if you go to them and they just refuse to even hear you out, I would say go to a different provider. There needs to be that willingness to listen and engage with you, have that shared decision making. I do say for women on Ovum, like they won't even look at your Ovum report, like that's a vetting tool. Like they should, you've gone to all of that effort, but it doesn't have to be Ovum. I think find that right person, dietitian, naturopath, clinician, whoever it may be, to support you, because you can't necessarily do it alone and you don't have to. So those would kind of be my 3 things is like listen, track, understand, and then see a provider to support you in that journey.
Why do you think it's sometimes a bit hard for women to trust themselves?
I think it goes back to like the beginning of this conversation, which is an element of actually recognizing the intuitive feeling in the first place in a very busy environment, stressed environment. The more stressed we are, anyone, doesn't matter how intuitive, the less intuitive we become, right? Because the adrenalization, it just suppresses that like emotional capacity. But I do think then it's the systemic biases that we've experienced as women, not just in healthcare, which is like to be quiet and to not speak up and like to be a lady. And to be a lady means to be like, keep it to yourself and to tolerate. And I think that, if you think of just our experiences of pain, it's almost like just get on with it and don't complain too much. And I think that feeds into that, especially if we're looking at trusting ourselves around health. I don't know. Do you have any thoughts on that as a woman?
Well, I think a lot of it is inherent, right? And it goes against your own second nature because there's, in my mind, for want of a better word, it's like, oh, I can't have the audacity to know what's happening with me. That sounds crazy. So I think unfortunately that's a lot of people's default setting.
Yeah.
Where it shouldn't be that. And what I've learned from this conversation is that it isn't that.
No.
Like often if something is wrong, you will know.
Yeah.
And as you say, doing these little bits of homework but not have it be such homework is going to help you in the long run.
Yeah, exactly. For something you're doing just regularly, right? And it's just there rather than only, I think this is another important takeaway, not only when you have a chronic symptom. Track when you're good and when you're bad.
Ooh, okay. Track when good and bad. Why?
Because how can you see the things that are good? Like how can you see the things that are impacting you in a positive way if you're never tracking them? So if we're only tracking when we're feeling bad or when we're in pain, it's really hard to then see the difference when we're good. So I can put it into example of like when I was trying different chronic medications for migraine, I would say, I've had no good days. And my husband would be like, you literally were fine for like 3 or 4 days. And I was like, no, I wasn't. Because when you're in it, when you're feeling bad, it's all you can feel and remember. So then I was actually not seeing if a medication was helping me or not. And even recently, obviously, I've used Ovum now as, being the founder of it. and I say 60 seconds 3 times a day. So morning, lunchtime, night, track like energy levels, sleep, what I'm eating, my workouts. And what I've noticed is I'm actually learning a lot from my good days. Like, oh, what did you do so your energy was not bad in the afternoon? Like, what did you do when you woke up feeling really like positive and excited? Like, what did you do the night before? So I think it's like all of these little things we actually don't track, which are really the most important. They're the most influential in having a happier, more positive life. So I think that that's from like just a health perspective, but also just like a general life perspective is track when you're good and when you're bad. And then you've got a longitudinal data set of yourself that makes it easier to advocate for yourself and what you need.
That makes so much sense.
Yeah.
And I can't believe I've never actually, that's not occurred to me ever before.
Yeah. Honestly, I've come to this realization in the last probably like year of my life as I've been actually putting it out over into the world and using it in this way. I was like, oh, wow. Like, because I'm not, I would say honestly, like I'm not an obsessive health tracker. I'm not like the real obsessive, person. You can see I don't have an Oura ring or an Apple Watch on me. I actually had to take those off because they were just too much. But I found like there was that. I was like, why have I never done that before? That was, I think it's really interesting. I recommend anyone who's listening to just experiment with it and see what they learn. Like, what do you have to lose other than just learn more about yourself?
I'm so with you. I'm so inclined to always feel that, oh no, nothing's been positive, which is bad.
Yeah, I think who was I speaking with? I think it was my business coach, and she was like, yeah, our brains, obviously from like a, biological like survival, we focus on what's negative. Like that makes sense, right, from a biological point of view. But then I just thought, well, yeah, why? And it also makes you feel better. Like when you write down that you've had like a good day and you've like done all these really great things, like, oh, actually I'm proud of myself.
Where can people find Ovum? Where can they find your programs? How best to get in touch?
So you can find us on Instagram, Ask Ovum. You can find us on LinkedIn as well, just Ovum AI. Website is www.askovum.com. If you want to get in touch, you can on our website register to get introduced through our partnerships program as well. So we are not only on the App Store, but we actually offer it in the workplace as well. So if anyone's listening and they'd like to see if they could get Ovum in their workplace for their employees, obviously we spoke about the impact of the gender health gap and women in the workplace needing more support. Please get in touch.
And finally, for everyone who's been listening to our very long but very interesting conversation, what is the takeaway? What is the takeaway you hope that they've got?
Believe yourself and advocate for yourself. Knowledge is power, and that knowledge comes from what you learn from external resources, but also what you learn from yourself.
Dr. Ariella, thank you for joining us on Fernwood Unfiltered. And remember, if you have enjoyed this episode, make sure that you share it with someone that you love, because if you've liked it, I bet that they will too. Talk to you next episode. Thanks for listening to another episode of Fernwood Unfiltered. Just a quick note that the information shared in our episodes is for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always seek the guidance of a qualified health professional regarding any medical condition or concerns you may have. Catch you in the next episode.